on Doctor's Diaries.
My husband said it looked like he wasn't moving, so he might have stopped breathing for a few seconds there also. And then today, right before we came, he stopped breathing again.
Some days, for whatever reason, a lot of traumas come in. Just when you finish working up that trauma, another one will come in. Here, Vern from White Plains, come over here.
I see this stuff on ER every night, and look, now I'm gonna be on it.
That always happens.
The biggest impact on my life is how it affected all of my family and friends. Because, you know, they hear the word cancer and they think it's, you know, a death sentence, and it's not.
Just want her to kind of be normal, like normal kids. I want her to eat. I want her to have an appetite. I want her to walk. She should be walking like months ago.
Yeah. 16-month-old Summer Rasool's mother is worried that her daughter, who was born with kidney failure, won't grow up normally.
Wow.
I just wanted to develop. I wanted to catch up. I wanted to mingle in with the kids and not be left out because she can't walk or she can't. I just want to see her do those normal things.
Summer's only hope of leading a normal life is a kidney transplant, and Mona hopes that she can be the one to save her daughter's life by donating her own kidney.
Everybody knows she needs a transplant, and I always thought, you know, I'll give her mine, and ever since then it's just always something that I looked forward to, you know. I wanted to do it so bad. What are you crying about?
One of the parents, you know, should be the donor. That's the best bet. And Mrs. Rasool was the one that came to us and said, I want to be the donor, to be considered to be the donor first.
Just because they are mother and daughter doesn't mean their kidneys will be compatible. In order to determine whether Mona's kidney is suitable, both she and Summer must go through a battery of tests to make sure they are a perfect match. Mona has become accustomed to watching her daughter getting poked and prodded throughout the process.
The beginning was always like, I was always crying, you know, and just thinking, when is this ever going to end? And then, you know, when you come to a stage where you just get on with it, you don't even think of the emotional side. You stop thinking about the emotional side and you just start thinking it's good for her, she needs it, and you just get on with it.
Dr. Robert Weiss, Summer's kidney specialist, examines her for signs of a cold. If she develops so much as a cough or a sniffle, the surgery could be canceled at the very last minute.
Good. You passed the physical. All right, we'll keep our fingers crossed. We'll say prayers. We'll do everything.
Thank you.
All right, you take care, and I'll see you in a week.
Okay, great.
All right?
Okay.
All right, goodbye.
Say bye-bye.
See you next
Bye-bye.
week. See you next week.
The kidney transplant surgery will be in 7 days, if they can both stay healthy.
Zoom, zoom, around the corner we go.
Deborah Mansour is about to undergo radiation treatment after having a brain tumor removed. The frame that's attached to her head will be used to stabilize her during the procedure.
I had a headache one day and just didn't seem to be the same. For a week this went on and it didn't seem to get any better, and it was getting harder to focus on what I was doing, and I became concerned about, you know, driving and, you know, my safety. And so I decided to call my doctor, and I thought, oh, they'll just say, you know, you just don't feel like yourself, you know, and kind of brush it off. But they took me seriously.
After she presented to her private medical doctor with those complaints, he got a scan of her head. The CAT scan showed some abnormalities, so she got an MRI, a magnetic resonance scan of her brain, and based on that, she was sent to me.
Literally 1 week from the initial headache, they discovered a mass that was probably about the size of a lime.
The mass turned out to be a malignant brain tumor. It was removed about a month ago, and Deborah has had ongoing radiation and chemotherapy treatments. Today, she faces yet another hurdle, a more precise and focused radiation therapy prescribed by her neurosurgeon, Dr. Deborah Mansour.
It's very specifically focused to the remaining tumor bed area where they have removed everything, because there will be remaining cancer cells, if any. They need to zap those out.
This treatment requires pinpoint accuracy, so the stabilization device must be adjusted, as even the slightest deviation could cause brain damage.
I have to say, you have the longest and the most hair I've seen in a long time.
But you know, her hair didn't really change color, did it?
No, we went for the red-on-red look.
Yeah. It's the Ken, the Barbie Ken, like plastic hair.
Yep.
Okay.
I've met amazing people through this whole process. I have learned things and been blessings to other people that, you know, I have to believe was the purpose for me going through this. Yeah, I thought it was heavy before.
Yeah, it's going to be a little bit heavy, but you know what? Not for very long.
Yes.
Okay?
Believe me, I'm looking forward.
I
I have very strong faith and have been through a very challenging year. So I knew that I had nothing to fear because it was being taken care of by God.
It's 6 o'clock in the morning when Mona and Summer arrive at Westchester Medical Center, 1 week after passing all their pre-admission tests. If all goes well today, Mona will be giving one of her kidneys to her daughter.
Oh, I wonder what it would be like to have one kidney. But I've talked to so many parents who said that they don't feel anything. They don't feel it. Just get on with their lives, and they don't feel any different at all. So I'm not worried about that at all.
With everything in place, the moment everyone has anxiously been waiting for is finally here.
There are two teams that work almost simultaneously. In one room, we'll be working on Summer. At the same time, in an adjoining connected room, my colleague, Dr. Teixeira, will be taking out the kidney from the mother, and then we just stitch it into the recipient.
You let me know when it's 2 minutes since that when I have pregnancy. Move this chair from behind me, please, somebody. Okay.
Dr. Julio Teixeira will use cameras and miniature instruments in the procedure to remove Mona's kidney.
We use telescopes that are connected to a camera, and we use a monitor, and through the monitor we're able to perform the surgery as if you're actually looking at a video game. The hand-eye coordination is completely different in that you're not actually looking down on the patient and on the kidney itself, but you're looking at a monitor and operating through that monitor. We're dropping the kidney. We're dropping the kidney. Damn, we're dropping the kidney. Pull back the camera, please. Come in, look up. Section, you gotta go up, further up. You gotta be way up in the kidney section. There you go. Right up in the kidney. Okay, Jesus. So now we're gonna get ready to take the kidney out. So
I'm gonna call Bud, right?
In a minute.
Once Mona's kidney is removed, Dr. Butt has very little time to implant it into Summer. Each passing second could affect the kidney's viability.
How much? How much time? How much time?
1 minute, 13 seconds.
With Mona's kidney safely out, Dr. Teixeira gives Sade the good news.
Hey, yes.
Oh.
All right. How are you? All done. Everything went fine. No problems.
Thanks.
Yeah, she did great.
How's Summer doing?
Summer's doing fine. Everything's going really routine, smooth, no problems.
Yeah, I'm actually coming from the dialysis, Dr. Butt's office now.
Oh, okay. Dr. Butt is putting the kidney in Summer right now as we speak.
Okay.
And everything is going really well, no problems.
Okay.
Mona's operation went perfect as we expected,
Thanks.
no problem. So she should be in the recovery room in a half hour if you want to come by and see her.
After her surgery, all Mona can do is wait to hear about her daughter. 3-month-old Nicholas Diaz was born with Down syndrome, as well as a serious heart defect. After 9 days at home on a heart monitor, his parents became frightened when they discovered him fighting for breath.
His monitor went off. He's on monitors and stuff at home. And when my husband got up to check him, he was breathing, but it did say apnea, and he was real pale. And my husband said it looked like he wasn't moving. So he might have stopped breathing for a few seconds there also. And then today, right before we came, he stopped breathing again. And they did CPR on him.
They did do CPR.
Well, mouth to mouth.
Okay.
Yeah,
His heart
didn't
stop, just his breathing. Okay, there's a big difference.
Yeah.
Okay, and I'm sure that they explained that to you before.
Yeah.
Okay. Just checking to make sure you're okay.
Nicholas is a very sick baby who has a fairly severe form of something we call atrioventricular canal defect, which is a fairly complicated heart defect. In addition to having very big holes between the upper and lower chambers of his heart, the main valves within the heart are also very abnormal.
Pretty much what they weren't considering surgery on him at all because of him being so small. They didn't think his defect was that bad.
Oh, hey, there he is.
Now we're up and running.
Nicholas. Just watching him breathe was, he was breathing really fast, and you could actually see his chest become bigger because his heart was enlarging from pumping so much extra blood around. So I ended up talking to the cardiologist, and they did some echoes and said they all agreed to that something had to be done.
In order to receive the high-level care that Nicholas needs, he must be transferred to Westchester Medical Center, the only pediatric intensive care unit in the area. Once there, Dr. Lester Permit discovers an additional problem that further complicates his situation.
Nicholas came to the hospital with an infection called meningitis. So he was really in a situation where he was quite sick. And on top of that, and sort of as a background to it all, was the issue of his heart problem, which was also leading him to have symptoms and signs of heart failure. If we can get Nicholas through all these things, and when I say we, it's really if we can help Nicholas to get through, because he's the one that's actually getting through it, then it becomes all the more satisfying at the end.
And you guys were lower.
With the stabilization device in place, Deborah Mansour is finally ready for her high-dose radiation treatment. Her hope is that it will kill any remaining cancer cells.
I have a request, because I hear you have music going in the background, but while the thing's going on, can I ask that it be turned off?
Sure.
No
music?
No music, because I like to focus on my own meditation and visualization. That's where my faith comes in, because I just give it to God and say, show me which direction I have to step next.
You're going to hear a noise in a couple of minutes. The floor is going to drop.
Okay.
That's it.
Thumbs up, everybody.
All right.
I just talk to God because, He has carried me through everything, and if I release my pain to Him, I don't have to worry about what my physical body has to suffer here. The biggest impact on my life is how it affected all of my family and friends. It is much harder for people who, they hear the word cancer and they think it's, a death sentence, and it's not. Yay! Yay!
So are you starving?
Very.
Oh, that would be my problem. I would be so hungry.
Yeah.
Could you eat anything all day?
They let me
juice
have
and
Jell-O,
Jell-O.
right? They did let me, but you know what? Eating Jell-O with a frame on is a little bit tricky.
A little bit difficult.
She actually was trying to discourage it to begin with, and I said, I think I can do it. And I figured out how to slip it in, and you just take small amounts and tip it straight up.
You just need a bent straw.
Okay, everybody gonna lift me, or?
Yep. We want you to just relax, okay?
I obviously am taking the right steps because other cancer patients, they're looking to me and saying, wow, hers is so much more serious than mine. How is she doing so much better? And I can say, it's because I believe that I will be well.
Now, it's going to feel like it's tightening, okay, but it's actually loosening, all right? So just give it a couple of seconds and we'll get this going.
Clearly, Deborah's, faith is one of the things that helps her get through this more than just about anything else. It's helped her to keep a very positive attitude, and I think it serves as a tremendous support system. And in all patients that have cancers or brain tumors, these things, it's exquisitely important for them to have a support mechanism.
Yeah, I know. I'm not going anywhere until you guys unwind me.
Get your hair out of there. No, we have to put the...
You tell her I told her it's the most hair I've dealt with.
I know, it's like...
time.
You guys don't get to deal with, chemo patients that have hair, right?
Right, exactly.
I will overcome this, and I plan on a lot of years of telling people how to continue, how to get that strength.
Yeah, please.
She's a pretty unique woman. She's probably discovered this tumor fairly early on because she's so active and athletic and sort of aware of her body.
Okay, ladies, I'm ready for that turkey sandwich, don't I? Better without the metal frame.
They'll take another set of
And tomorrow's just another day like any other day. Get up and get the kid ready for school and go about the housework and, have fun. Probably have to make a few phone calls to let everybody know that I survived this just fine. Get on that internet and thank everybody for their prayers and, just move on with, enjoying life. So, excuse me while I eat.
I will continue to follow Ms. Mansour as she progresses with her treatments because this tumor will probably still recur even though we have a complete resection at her initial surgery and scans that don't show any active tumor right now. And when this recurs, we'll discuss with her what additional treatments she may be eligible for or want to have done.
And we're out of here. Expect a miracle. Ladies, thank you. Have a great day.
Just hours after Mona's kidney is extracted, Dr. Butt is about to see whether a mother's sacrifice is worth it.
For the moment, it's just connected there, and we are waiting for it to really start working. This is a lady's kidney. It's a little bashful, Has trouble starting to urinate in public. Okay, scissors, fine scissors.
How's it going, Dr.
Very little urine so far, but I think Dr. Hara is working his magic.
All right.
Very soon it's going to start. The kidney looks good, though.
The kidney is not responding, and the doctors are becoming concerned.
Somebody do a rain dance, please. I don't know. This kidney isn't making urine. I don't know what's wrong with it.
When the kidney still doesn't produce urine, Dr. Butt calls Dr. Weiss, Summer's kidney specialist, to let him know about his concerns.
Hi, Bob. The kidney is not looking too good. We have good anastomosis, good pulsations on the renal artery, good signal on the vein, poor signal on the surface of the cortex, looking soft and bluish. It was pouring out urine on the other side, so only a few drops came out.
With nothing to do but wait, Summer's father finds himself reflecting on the difference between someone else's tragedy and the one that lands on his own doorstep.
One lesson basically I've learned is, when you hear somebody's baby, or your friend's baby, or whoever, and you hear, that they have like maybe a liver problem or maybe non-functioning kidney or what have you. You basically, you say, oh, I feel really bad for them, but you have no idea. It's a very sobering thing, because when it comes home, it's different.
Hi, how are you? It went well, everything went well, but the only concern right now is that there's not much urine coming out of the kidney. We expected a lot of urine to be coming out. So I think it should start to make urine in the recovery room, or maybe in the next couple of days. I just hope that it'll start to make urine soon so that we won't have to keep her on hemodialysis. I'm fairly confident that very soon the urine should start to flow. A few drops came out, but you expect a lot of urine to come out.
All right, thanks. Thanks a lot.
I wish I had given you exciting news, but
it's
not
pretty
too bad.
exciting.
It'll be all right.
It's pretty exciting. Thanks.
Now my shift is usually 1 to 1 or 11 to 11. And when we come in, we usually do like relieving of lunch first, and then we go on. All right, Lindy, you need to go to lunch.
Registered nurse Janet Bailey has worked the swing shift in Westchester Medical Center's busy ER for the past 2.5 years. Her first patient of the day is Larry Jordan, who lost control of his car and was partially ejected. The extent of his injuries won't be known until test results are back.
C-spine was good, but they have not removed the collar. Okay. Still has his engine tubing, but the contrast was sucked out.
Okay.
Nurse Bailey will keep a watchful eye on Jordan's progress.
I see this stuff on ER every night, and look, now I'm going to be honest.
That always happens.
No sooner does she begin treating Mr. Jordan than the STAT flight team brings in a heart attack victim who needs her immediate attention.
Get that hiney over one more so I don't lose you. Okay.
Robert Wildey has been experiencing chest pain for the past 4 days, but today the pain was unbearable, and he finally decided to get it checked out before it got any worse.
I thought it was like from smoking too much,
How much do you smoke?
Well, I like to smoke a pack a day, but when I cut down,
okay,
and the pain was still there, I thought I had bronchitis, or maybe it's even going into pneumonia, how it hurts your lungs. I don't know if I've ever had that. And that's what I thought. But I knew something was wrong. A heart attack was just about the last thing on my mind.
Wasn't really what you were thinking about, yeah.
I'm a healthy guy.
I love cardiac patients. They're interesting. You have to think a lot. You could give them certain, depending on if they're in a certain kind of rhythm, you can give them medication and change that. Use a lot of your mind with cardiac patients, a lot of thinking. All right, I'm gonna do some pulling and I'll apologize. Yeah, but these don't go with our machine, so.
This is the one.
Yeah, that one's gonna be really hard because you got chest hair on
I know. Rip it real quick. Oh, there you go.
I don't want to get it. Okay. Pain go anywhere, or did it just stay in your chest?
Just staying right here.
Okay, didn't go
Just
into the
annoying.
back or your jaws?
No, I do have, my teeth hurt a little bit.
Your teeth hurt,
But I've been
okay.
to the dentist, so I don't know whether that's,
Does the teeth pain come with your chest pain?
Probably a little bit. Because it's, affecting I have a headache.
Okay.
Maybe it's sinuses.
Okay. Now, he was complaining of chest pain, and it's not just typical. I mean, he said he had teeth pain, and that's very common with people who are having heart attacks. And everyone is different. It's not, chest pain, left arm, always. Everyone presents. Sometimes people just have elbow pain, or, everybody is different. So his teeth pain is significant.
When Wildey's pain is not reduced by medication, Nurse Bailey must transfer him to the cardiac catheterization lab for further analysis.
All right, here's your space.
Hey, Janet, how are you?
Good, how you doing? What, we crashed? This is Robert. Try and get them dispositioned. That's like your main goal, to get them somewhere, whether it be the OR, the ICU, floor, or home. Like, that's your goal. Another clinic, another hospital, something. That's your goal. Good luck.
After Bailey hands over the care of Mr. Wildy to the team in the cath lab, she follows up on lab results of Mr. Jordan's car crash injuries.
Everything came back negative, all the tests, so I said I can go home.
Awesome. Let's see your head, man. Did you have to get any stitches or no?
Yeah, I got five stitches here and 2 behind my ear. That was it.
Wow, you are a lucky man.
I know. I know.
So are you going home? You're leaving now?
Yeah. Well, I gotta wait for my discharge papers, but I'm gonna leave definitely today. Thank goodness.
That's awesome.
All right, Larry, I'll expect a check in the mail. Okay, you got a tetanus today?
I can't see that. All right. I lost my glasses.
I'll put your hand where it is.
All right.
You got a tetanus today, okay? Remember that. It's good for 10 years if nothing happens to you, 5 years if something does. If you need anything, anything different changes, and you get please, by all means, come back.
Okay.
Right here? Yeah, that's good enough for me. Got good handwriting, Larry.
Yeah, right. I can't even see it. What?
Room 6. Right, the lady has Diaries.
Am I all set?
Goodbye.
Thank you.
You're welcome. You got the thing out of your nose. You got all your IVs. Yeah. No IVs, right? You got them all out? All right. Goodbye.
Thank you.
For more information, log on to our website. Three weeks after baby Nicholas Diaz arrives at Westchester Medical Center with heart problems and other infections, his doctor decides he is stable enough to proceed with treatment.
There's a concern with his particular kind of heart problem that the lungs become damaged as more and more time goes on. In his current condition, he really wasn't in a position to have a complete repair, which would be a very, very big operation. So as kind of a last-ditch effort, we opted to do an operation that may help his heart and let him get over the infection by decreasing the amount of heart failure he has. The operation itself is technically an easy operation to do, but his really sick condition going into surgery still makes it a fairly risky procedure.
They told me about the risks and everything, that they didn't really know what was going to be expected with the surgery because he does have an infection.
It can be discouraging to go into an operation in a child like Nicholas where you know from the beginning that there's a reasonable chance that you may not succeed. In most of the operations that I do and most of the patients I take care of, it's quite the other way around. We go in with every expectation that we're going to get a very good result. Nicholas was really kind of floundering. He was not just treading water, but actually starting to get worse. And certainly if we didn't do anything at all, it would have been inevitable that he would get worse and worse, and eventually he would die from one of the many complications that he was suffering. The method that we use for narrowing the pulmonary artery, which is called pulmonary artery banding, is to place a suture around the pulmonary artery, and what we use is actually called umbilical tape. That is actually what they use to tie off babies' umbilical cords.
Although the operation is going well, Dr. Permit finds it necessary to insert a tube to help Nicholas breathe.
I think his prognosis really is quite good, but in the back of my mind, I know that he could still get an infection, he could still have a setback that could be life-threatening.
Despite all the challenges Nicholas has yet to overcome, Dr. Permit remains cautiously optimistic when he talks to the parents.
Hi.
Hi.
We sent word out, actually, but I guess you had stepped out of the waiting area, and that's understandable. Everything really went very well. In fact, I don't know whether anybody had told you, it took us about 3 hours to get his IVs in, and then an hour to do the actual operation.
okay.
So the operation, as expected, was very small and quick, and we didn't really have any problems. He still has a long road to go, but I think that this has the best opportunity for him to be able to now do the things that he has to do. Nicholas's parents are really pretty amazing through all of this. They have always had a very positive attitude and outlook about Nicholas. They've always been very understanding. That really makes all of our jobs in taking care of him much less difficult.
Okay.
Once he's over the effects of the surgery itself, and once his lungs have a little chance to see the benefits of the surgery, is that he should be breathing much more comfortably. We shouldn't see his heart pounding away as much as it used to. I sort of think about Nicholas's situation as if he's been trying to fight with one hand tied behind his back, and the operation that we did doesn't cure anything, but it sort of gives him a chance to fight with both hands. So really, it's hard to predict how well he's going to do in that fight. He still has a lot going against him, but at least now the issue of his heart failure won't be one additional major factor that was making it so difficult for him to recover otherwise.
We knew he was, I mean, he's a pretty good fighter. We knew he was going to make it through.
Some days it's crazy. Other days it's hurry up and wait. And some days you're just like in gridlock. And that's what the ER is. It's constant change. It's just new experience every day.
Registered nurse Janet Bailey prepares for another unpredictable day in the ER. Her first patient, a 23-year-old motor vehicle accident victim with unknown head and neck injuries.
All right, ready? 1, 2, 3. All right, there we go back. What hurts when we did that, sweetie?
My neck.
Your neck?
LeVar Moriel was cut off on the road and crashed into the car in front of him. He lost consciousness, but came to before getting to the hospital.
We understand the system. You're slow sometimes, you know. It's not like you see on TV. It really isn't. You don't go from whisking through the doors up to the OR in 15 minutes. It very rarely happens. Okay, we're going to do some lab work now. Try to stay still, though, honey, okay? I'll get you a blanket, all right?
Bailey conducts the standard battery of tests to determine the seriousness of his injuries.
Blood work takes about a half an hour, okay? Then the doctor wants to do some x-rays. Some days, for whatever reason, a lot of traumas come in. Just when you finish working up that trauma, another one will come in. Here, Vern from White Plains, come over here.
Steve Kokias is an auto mechanic who burned his hand when a fire started on the car he was working on.
They had soaked your hand over there in a little water? Okay. How do you feel now? Do you need anything for pain?
No.
You sure?
Not yet.
Okay. Yeah, you got a little carpet left there, I guess. Huh?
Yes.
You got a couple of nice little blisters, but it doesn't look too bad. Let me go get some more saline and we'll soak that, all right?
It's getting close to the end of Janet's shift, and luckily, neither of her patients needs to get admitted, so Janet will be going home on time.
All right. Going home. I go home, and it's like, it's nice, it's quiet. Shut the car radio off, and you unwind, and you go home. All right, dear, goodbye.
Hours after Summer's transplant, doctors are worried that her new kidney still isn't functioning properly. But suddenly, in the pediatric intensive care unit, there's a cause for hope.
Is that my imagination?
Wow.
Is that my imagination? No.
Let's pee.
I think that's what it is, right? Hey, look here.
That's not a discolored tube, is it?
No, but I think I just saw some urine coming. Yeah, I think there's some urine coming out of her. Wow.
Yeah, she's had quite a bit since she's been out.
Yeah, it's coming. Yeah. See?
About 50, 55.
But in another part of the hospital, a mother's intuition senses a setback.
I knew something was going on last night because it felt very odd to me that nobody was telling me exactly how much she was outputting. She wasn't making that much urine, and it felt really odd to me because my husband kept on saying, oh, she did 40 cc's, she did 16 cc's, and I felt like that's hardly anything. But my husband was excited, and I don't know why he was so. And I thought, well, maybe that's a start. Maybe she's supposed to just do that much.
Days later, Mona's fears are confirmed. An MRI verifies that 2/3 of Summer's kidney has failed.
Going through all the images, it's become clear that the flow to the upper portion of the kidney is good, but the flow to the lower portion is not. So they will probably take this child back to the operating room to take a look and see what's happening with the renal artery at the level of the anastomosis to see if they can repair it.
2/3 of her kidneys is actually kind of turned off because it's not really working. She had a blood clot which had actually stopped the blood flow into the kidney. So 1/3 of the kidney is actually working, which is good in some way because it's giving us hope. It didn't completely shut down. So we're just hoping that that will stay working. That's all we're hoping for right now. But I mean, if it shuts down altogether, I don't know what I'd do. I don't know how I'd handle it. Obviously, I'd just be really, really devastated.
I think the major issue is, will it be enough, even if that 1/3 does function well? Will it still be enough to have her discontinue dialysis, and will it be enough to have her off dialysis for an indefinite period of time versus only a few months or years?
Unfortunately, Summer's new kidney never works well enough, and 2 weeks after surgery, she's back on dialysis.
It was disappointing rather than surprising that we didn't have a total surgical success. We know that the success of second kidney transplants is as good as first, so that she has a very good chance, even if this kidney transplant is a complete failure, that a second kidney transplant would be a complete success.
She'll need to come back for hemodialysis 4 times a week. It's not totally disappointing because she still has my kidney. I was thinking the worst. I was thinking that they were going to take the kidney out and I'll go home, you know, and her going back to square one. Sometimes I do have a hard day or not on a very good day, but I just kind of get on with it. I don't have much choice. I have to just get on with it. Just day at a time. That's how I do it.
For more information, log on to our website.
Apple, I don't think she'll like that.
An hour north of Westchester Medical Center, emergency room nurse Janet Bailey takes on the other shift in her life, the one as wife and mother.
You come home and it's like, oh, you know, like my house, my family, you know, my life, and you're so thankful. I'm glad I have a nice, quiet little home.
Come on, let's just get the first mouthful, and then you're all right. Come on, open up. There we go.
Oh, is that good? Sweet potatoes and creamy chicken.
Janet's husband, Rich, is a New York City fireman. They both save lives for a living, and they both do it at odd hours.
He does shift work. He works 24s, a couple days a week. It's nice because both of us kind of understand that work is a lot and it's tiring. And when we're home, we like to relax, hang out. We do, you know, I mean, in the winter we ski, and now this winter I'm not really sure what we're going to be doing with the baby. Come on, we'll go play with Tigger. Come on.
Now that she has a daughter of her own, Janet finds when it comes to caring for children at the hospital, she has trouble being objective.
When you see a sick kid, you hear them crying. It's different. They've always told you it would be, and it is. A little closer to home because you have someone else to worry about. Who's that? Who is that, Tigger?
Squeeze both my hands and bounce me.
Juggling career and home, Janet turns to other activities to unwind.
I love to cook. I love to bake. I'd rather bake, actually, than cook because I like to eat dessert better than food. You're getting a little grouchy. What's the matter? You want to try some cheese? You just are so thankful that my life is so dull. It's fun and I do my thing, but my life, I've never had any real tragedy. And, you know, life is great. You can't ask for more than that.
A month after successfully coming through surgery, Nicholas Diaz had a second surgery to completely repair the holes and defective valves in his heart. Today, Chief of the Pediatric Intensive Care Unit, Dr. Carrie Goltzman, will find out if Nicholas can survive without a breathing tube.
He had a surgery 2.5 weeks ago, and he's been doing pretty well since then. Now we're going to try and pull his breathing tube out in a couple of minutes. He was a real sick kid. This is a very excellent save if everything goes well and we get him off the vent. Okay, how is he? Oh, what a man!
After the breathing tube is removed, everyone holds their own breath to see if Nicholas can let out a good, healthy cry on his own.
That's it, I hear him. There! What a good boy.
Good boy.
Nicholas has taken another step on his road to recovery.
Morning.
A few days later, Dr. Lester Permit, Nicholas's heart surgeon, checks up on his progress.
Good morning, Nicholas. Oh. Are you sleepy? You sleepy this morning? Sorry, I know that's cold. I think from every perspective, to me, he looks very, very good. He gets a good medical grade, but now we have to see to the more mundane things like feeding and just getting back to normal baby things.
For Nicholas's parents, relief. A happy end to a long and trying journey is in sight.